Hi, welcome to the wonderful world of orthodontics. You're now on your way to a new healthy smile that will last you a lifetime. Our goal is to provide you with an extraordinary experience, but that's going to require a team effort. Your role throughout treatment is very important, but very simple. Just follow a few of our recommendations. And here's Nikki to tell you more.
Thanks, Dr. D. Orthodontics is a team effort, and to get that beautiful smile at the end of treatment, you have to take good care of your braces and yourself when you're away from our office.
The first thing to keep in mind is that you might feel some irritation in your cheeks when you get your new braces, and that's normal. You might also feel some tenderness and slight movement in your teeth and a difference in the way your bite feels, which again are all very normal. You might also have a little difficulty with your speech at first, things like slurring your S's and irritation to your tongue. To help with that, remember this exercise. Put your tongue to the roof of your mouth just behind your front teeth when saying words with S, D, and T. Also, try to over-enunciate your speech. That will also help you adjust. If you feel any slight pain or discomfort, you can definitely take over-the-counter medicines like Advil, Motrin, or Tylenol, and that should help. And you can also use Gishygoo. Just put it on the area of your braces that your tongue is still getting used to, and you can leave it on all day, even while you eat. Just remember to clean and floss well once you take it out. Another important thing to remember is that taking good care of your teeth, gums, and orthodontic appliances is vital to the long-term health of your teeth. So remember, you still need to see your dentist for cleanings during your orthodontic treatment, at least every 6 months. To brush your teeth with braces, you can certainly use a regular manual toothbrush or an electric toothbrush like a Sonicare or Oral-B brush. Those will work fine as well. Just remember that when brushing, you'll want to use 3 different angles. Start by brushing down on top of the braces, putting enough pressure on the brush to get the tips of the bristles under the wire. Brush from one side to the other several times, and then do the same up underneath your braces and then directly on top of the braces. And remember to gently brush the gum line too. That's where your teeth and gums meet, and doing that will keep your gums from getting puffy during treatment. And of course, you need to remember to brush 3 times a day, after breakfast, after lunch, and before bed. And it's not a bad idea to use an oral rinse, something like ACT, which you can pick up at your local pharmacy. You should definitely be flossing at the end of every day too. Flossing with lingual braces is slightly different from flossing with traditional braces. To start, thread the end of your floss through the eye of the threader. Then push the stiff end of the threader from the front through to the back of your teeth at the gingival edge above the point where your teeth come together. Take the floss down under the loose portion of tissue between your teeth and scrape up the sides. Some patients like to use things like Superfloss or platypus flossers, which again, you can buy down at the local pharmacy. These little things called Proxy Brushes can also be used between the arch wire and the braces to help loosen food particles, remove plaque, and stimulate your gums. To use them, just push the brush gently under the arch wire between brackets. But don't try to force it, because you might accidentally break a bracket loose. So only use the Proxy Brush in those areas where you can be sure and use it gently. Wax can be used to cover braces that are irritating your soft tissues like your cheeks, lips, and your tongue. And here's how to do it. Pinch a small amount of wax out of the package, just large enough to cover the particular brace or wire that's causing your discomfort, and roll the wax into a little ball like this. Make sure to dry the area where you're going to be placing the wax. Then just push the wax onto the area like this and leave it there. Obviously, you'll want to remove the wax before eating or before you brush. And to do that, just lift it out gently with your fingernail. Now, if by chance you forget to remove the wax and suddenly realize you've probably swallowed it, don't worry. Just remember to reapply the wax as often as needed to keep yourself comfortable or until you get used to the feel of your new braces. In addition to using wax, you can use what's called a miracle rinse solution 3 to 4 times a day. It'll help alleviate soreness and promote healing. And you can make Miracle Rinse pretty easily by combining equal parts of liquid Benadryl, Maalox, and water. Just swish it around your mouth for about 30 seconds and then make sure to spit it out. don't swallow it. On rare occasions, one of your brackets may come loose from a tooth, or a wire may poke out and irritate your teeth or gums. If these things do happen, don't worry, it's nothing to get alarmed about right away. And in fact, there are ways you can fix these problems on your own, temporarily, until we can see you again in our office to fix them for good. We've got another video you can watch that talks all about that, and you can find it on our website and on our YouTube channel. Eating the wrong kinds of foods can cause damage to your braces, which will probably make your time in braces longer. Here's what we're talking about. Hard or crunchy foods like corn nuts or nuts in general. Avoid chewing on things like ice cubes, Jolly Ranchers, Jawbreakers, Sweet Tarts, Sprees, Nerds, Tic Tacs, popcorn, Lifesavers, all that stuff. You can still eat crunchy fruits or vegetables like apples, carrots, or celery, but you need to cut them up into smaller sized pieces and only chew on them with your back teeth. Also, avoid any sticky or tacky foods like caramels, taffies, now and laters, sugar daddies, Starburst, and stuff like that. Just like those crunchy foods, they can damage your braces and mean you'll have to wear your braces longer. Your clinical assistant can answer any questions you have before you leave today, and you can watch this and other helpful videos anytime on our website. Plus, you can always reach us by phone or by email if you have any questions, concerns, or problems anytime during your treatment.